So one of the topics that was just raised was the symptomatology and what the patient's symptoms are. Dr. Denoff, you see a lot of these patients. Can you describe their symptoms and what you're seeing in them?
Sure. I think that the symptoms of progressive interstitial lung disease are very similar to the symptoms we associate with ILD in general, those being the presence of shortness of breath, particularly with exercise or exertion, and then cough, and often sort of a more diffuse sense of fatigue or weakness or inability to accomplish what the desired goal is. And, what we hope to see is that when we meet a patient who has interstitial lung disease and we identify the etiology of the disease, that we can make an intervention that stops the progression of the injury to the lung, and that their symptoms go along with that, that their symptoms improve as their lung disease improves. Unfortunately, even with appropriate identification of the etiology and appropriate treatment, there's a subset of patients who don't respond in that way. And I think, as Justin very nicely outlined, there are people who have progression in their lung function testing, in their CT scanning, and that typically is associated with also worsening symptomatology. So becoming more short of breath, needing oxygen, needing more oxygen, being able to do less exertion, having a cough that becomes disabling. So many of those symptoms can go along with the progression of their interstitial lung disease.
And does that go along with the range the other clinicians are seeing in terms of the severity of symptoms of the patients that come to them?
Yeah, I think symptoms are somewhat variable from person to person, and that really depends on what their baseline activity level is. So patients who are fairly inactive to start with may not notice the early changes of lung fibrosis because they're not exerting themselves as much, whereas our patients who are very active will notice even small declines in their lung function. And then we have a group of patients who come in and are probably describing dyspnea, but really feel their limitations as fatigue or generalized weakness or just inability to do things, which I think is a fairly common. And then when you push them on it, they'll say, well, yes, it is my breathing somewhat that's limiting me, but they really sense it as this general sense of fatigue.
Dr. Oldham?
Yeah, I think that was nicely stated. Symptoms can range pretty broadly, but as Sonia pointed out, cough and shortness of breath seem to be, at least in my anecdotal experience, the best metrics of progression, but they can range widely.